What's up guys, it's John with another Tuesday test tip. Today we're going to talk about what to do if you hate a class in nursing school, but you still got to pass the test. Look, this happens to all of us. We got to learn everything that there is to learn in nursing before we can take the NCLEX, but there's going to be a few subjects that you just really don't enjoy. For me, that was OB-PEDS and maternity. I hated it. I hated clinical, I hated the books, I hated the whole thing. But I still had to pass it and I still had to do well. So for me, it was really kind of like pulling teeth out just to get me to study. But let me give you 3 tips to help you study for those tests and subjects you just don't like. The first thing is, get yourself to just focus on the signs and symptoms. If you don't learn anything else, just kind of memorizing those signs and symptoms. And I know this is completely contrarian to everything else that we talk about where we say, don't just memorize. But in this case, if you really just totally hate studying it, just kind of learn those signs and symptoms because knowing those is going to help you on the tests. The next thing is always consider patient safety. So like OB-PEDS, if you're dealing with abruptio placenta, understand those things that deal with the patient's safety and make sure you know how to address those things. Without learning all the other stuff about it, just understand the safety issues with it. Then understand the different nursing diagnoses that you might have for this patient and the different actions you would do for the things that you find. So deal with signs and symptoms, deal with safety, understand nursing diagnosis, and how you would take care of this patient. 9 times out of 10, this is going to get you a passing grade or a great grade on those tests. So even if you hate it, this can cut down your study time and help you get a good passing grade. Another thing that I would suggest, guys, is find those 1 or 2 disease processes that are actually kind of cool. For me with OB-PEDS, it was DIC. Disseminated intravascular coagulation. I was so fascinated with this disease process that I couldn't not study it. It was so cool. Where with most of OB-PEDS, I just hated it. This one really fascinated me. So if you can find that, maybe you hate mental health, find that 1 or 2 disease process that really gets you excited and dive into that and really enjoy it. The last tip I'm going to give you guys is relate it back to other content. If nothing else works and you just hate studying signs and symptoms, there's no disease processes you like, go back to the beginning, go back to the A&P, see if you can find any anatomy and physiology elements that you really can help you understand this. Maybe relate it back to med-surg, relate it back to pharm. Find another topic that you really like that you can kind of relate this back to. Those tips should help you be able to get a passing grade on a test in a subject that you just totally hate. Guys, we want you to succeed. We know you can succeed, but we don't expect you to be super passionate about everything, and that's okay. So don't judge yourself too hard. Once you get out of nursing school, you're going to be working in a field that you love and you can be passionate as hell all day long. All right, guys, this is John with another Tuesday test tip. Be sure to hit subscribe to get access to all of our Tuesday test tips. You guys go out and be your best selves today. Happy nursing.